So hello friends, hello students. In this video I will be discussing and making you understand the POPQ classification. This thing is the most confusing thing about OPS and Gynae for each and every student. Either they just mug up or they just ignore this classification. Many students just skip this topic when they read prolapse. I am going to solve you this thing for once and all. So I want your complete concentration on this video. If you understand this thing, then kindly comment on the video. If you don't understand anything, then also comment on the video. I will try to make another video solving your doubts. Now first of all, let's the name pelvic organ prolapse quantification. What we want to do, we want to quantize the prolapse of various pelvic organs. Which are the organs? It can be uterus, it can be cervix, it can be either anterior and posterior vaginal wall, it may be bladder, urethra, rectum, perineal body. Each and every organ, the prolapse of that organ is quantized universally. That means if you classified any prolapse according to POPQ, then around the world another person can really understand what organ actually has prolapsed and how much degree according to your POPQ score. So this is a very complex kind of classification, but I will try to make it easy for you. Now let's go with a very basic idea of this classification. How we classify this thing? The first of all, I will make you the anterior and posterior vaginal wall. This is the anterior vaginal wall. This is the posterior vaginal wall. Is it everything is okay? This is the cervix, and this posterior vaginal wall is little bit longer than anterior vaginal wall, as you all know. This is anterior vaginal wall. Sorry, I should make it thinner. Anterior vaginal wall. This is posterior vaginal wall. This is the cervix. This is posterior fornix. This is anterior fornix. You know this thing? Okay. Now, if you measure this anterior vaginal wall, we can safely say that it is 8 centimeter long, and the posterior vaginal wall is longer than anterior one. let's say 10 centimeter long. So this is the taken criteria, that anterior vaginal wall is of 8 centimeter and posterior vaginal wall is of 10 centimeter. Till now everything is clear? Okay. So when we talk about POPQ, we take one reference point, and which is that reference point? Hymen. Hymen is the reference point for POPQ classification. And where is the hymen situated? Here. Just imagine, here is the central point of hymen, and here is the external urethral meatus, EUM, external urethral meatus. Now this anterior vaginal wall is divided into two areas. One is of this 3 centimeter area and one is of this is 5 centimeter area. Similarly, the posterior vaginal wall also divided. This is of 3 centimeter area and this is of 7 centimeter area. Okay, this is particular region of 3 centimeter and in anterior wall and in the posterior wall. Similarly, in the anterior wall and posterior wall. Okay, now we will demarcate some points on this. First of all, how we measure or how we do this classification? We just have the patient in position of dorsolaryngectomy. It's just like a relaxed lithotomy position. A relaxed lithotomy position. Then we ask the patient to do Valsalva maneuver. What is Valsalva maneuver? You increase your intra-abdominal pressure maximum you can, so that the prolapse happens at its maximum range. So what we need to do, we just have a dorsolithotomy position of the patient and we ask the patient to do Valsalva maneuver. So the prolapse will be maximum at that time. At this time we measure the POPQ. Remember. And how we measure the POPQ? We identify the leading point of prolapse. We identify the leading point of prolapse. For example, this is the anterior wall, posterior wall and cervix. If this point is prolapsing here, as you see, this is the hymen. This point is the leading point of prolapse. This point in the anterior vaginal wall. Similarly, so we measure this point. Okay, we take this point. If the prolapse in the posterior wall like this, so this is the hymen and this thing is the leading point. Okay, if it is like this is whole uterus has been descended, then this point becomes the leading point. Which point becomes the leading point? The maximum point which is prolapsed from its site is taken as a leading point. Okay, now once we have identified the leading point, we just see the point, leading point, from which area it comes. From which area it comes. Okay, once we see the leading point and from which area it comes, so we have defined some points or some areas on anterior and posterior vaginal wall. These are the points of our demarcation. So this demarcation is of A. That means A means anterior wall and A is the anterior part of anterior wall. This range of points is of B, A. That means it is a B part of the anterior vaginal wall. This was the A part of anterior vaginal wall, this thing up to 3 centimeter, and this is the B part of anterior vaginal wall. So if the leading point comes from this area, for example, if leading point comes this area, then this point becomes A. If the leading point of prolapse comes from this area, then this point becomes BA. Okay. So, and then we compare and then we measure that point in the reference of hymen. See, this is the leading point of prolapse, and how much distance it has from the hymen. Let's say it is a 2 centimeter. Ideally, the AA point is defined as a minus 3 centimeters from the hymen. Any point above the hymen goes into minus value, and any point, leading point, comes below the hymen comes to plus value. So what is the normal value of AA? The normal value of AA point is minus 3. And once a leading point becomes there, then this point will be identified as leading point. And we will measure the leading point only. We will not measure minus 3 centimeter. We will just measure the distance between the leading point and the hymen. And from which area that leading point comes defines the region. So in this region, if the leading point comes, it will define as a AA. Similarly, what is the normal position of BA? Again minus 3. So if you see, this is the leading point, here we can say that from this value to this, from hymen to the leading point here, we measure the measurement. So if the BA point is from minus 3 to minus 4, minus 5, minus 6, minus 7, minus 8, this is normal thing. So any leading point which does not cross the -3 mark here, it is a normal thing, because this is the normal area of the BA point. But if the BA point becomes a leading point of prolapse and it just prolapse beyond its range of -3, then it becomes abnormal. Similarly, it happens into the posterior wall also. What is the normal range of AP? That is -3 centimeter. Here is the normal range. But once it becomes a leading point from this side of prolapse, then this point will be identified as a AP, and this AP will be +1, because anything beyond the hymen becomes the plus value. If here is prolapse happens, here prolapse happens and this kind of prolapse is there, then what is the normal value of BP, that is B point of posterior wall? It can be from -3, -4, -5, -6, -7, -8, -9, -10. Up to this point, we can say that yes, this is a normal point. If the BP becomes less than -3 or more than -3, then it comes in the range of significant prolapse. Here are two another points, that is C and D. What is C point? C point is a anterior fornix point of cervix. So when we see that yes, C is the cervix, so normally where the C lies at -8 centimeter. So your cervix should be at -8 centimeter from the hymen. If from the central point of hymen the C is at -8, then we consider it as a normal. If it becomes -7, then we can say that the cervix has descended 1 centimeter from its normal position. Similarly, it's about D point. D point is a posterior fornix point, and it suggests the it contains the rectal tissue. If D point descends down, the normal value of D is -10. But if it comes down, then we can say there is a prolapse here, like this. If it is come at -7, it should be -10. But if D point come to -7, then we can say that the D point has descended 3 centimeter from its normal position. Okay. Another point in the thing is what? GH, the genital hiatus. That means it is a value from external urethral meatus to the central point of hymen. This value is a genital hiatus. And if it is a anus, then from central point of hymen to the anus, this is a PB. That suggests the perineal body. And the values, normal values of these things are -2 centimeter and -3 centimeter. Okay. And what is TVL? Total vaginal length. It is 10 centimeter. All the measurements we take in this POPQ classification is when the patient is doing Valsalva maneuver. But when we take total vaginal length, then we should have the maximum relaxation or reduction of the prolapse, then only we can really measure the TVL, total vaginal length. So I know again this is not a very specific description of POPQ. You will only understand when you just correct some examples. Again I am repeating the points here. What is AA? If the or AP, that means on anterior and posterior wall, if the leading point comes from 0 to -3 range, then it is the point of AA and AP. What is BA and BP? If the leading point of prolapse belongs from -3 to TVL, that is 10 centimeter, then it comes as a BA or BP. C is the anterior fornix suggesting the cervix, and the normal value is -8. D is a posterior fornix and the normal value is -10. Genital hiatus normal value -2. Perineal body normal value -3, and TVL is a positive value 10 centimeter. So we describe like this. Now let's go with the example, how we show or how we do the pelvic POPQ score. So this is how we just show the POPQ score into 3 grid. So this is the result of a case in POPQ. Now can you just imagine what I have written here, what this thing shows to you, what you understand by this POPQ classification. As you can see here, the AA point is at -3. So AA point should be at -3. It is completely normal. The BA point is also at -3, or it can be at -4, -5, -6, -7 also. So it is a normal thing. The C point is at my cervix is at -8 centimeter. This is also a normal thing. TVL is a 10 centimeter. This is also a normal thing. Genital hiatus -2 centimeter, normal. Perineal body -3, normal. AP value -3 is also normal. BP value is a range from -3 to TVL. It is also normal. D is at -3. It is also normal. So there is no prolapse because every point we have described here are at their normal position. They are not descended. That's why we can say that safely that anything of this pelvic organ has not been descended, and this is a completely normal result. Now let's go with this thing. What is problematic in this case? You can see the AA is at +1, so that you can see that what is the normal value of A? -3, but it is at +1. That means that the anterior wall has just prolapsed outside like this. This is the hymen, this is the vagina, but this is the leading point of the prolapse. And so what is actually prolapse? Here is the urethra of bladder, so it shows the urethral prolapse. What is a striking thing here? It is a BA -3, which is a normal value. So anterior wall prolapse has happened, but it's only happened in the urethral part of anterior vaginal wall. So it will be urethrocoeli. C point is at its normal -8. That means the cervix is at normal, so there is no cervical descent, there is no uterine descent. GH -2 normal. Perineal body -3 normal. TVL +10 normal. Posterior wall is completely normal. You see those 2 points. The D point is at a normal. There is no posterior fornix prolapse. So only prolapse is of anterior vaginal wall, and this is a urethrocoeli. If we see this case, third case, can you find any problematic here? The AA thing is at A is -3. It is completely normal. But the BA thing is +5. What is the range of BA? -3, -4, -5, -6, -7 up to -8, which is actually the C point. So C point is at its position, but BA point has been descended +5. What it will look like? What the prolapse will be looking like? It will be looking like this. So this is the hymen. This part, this is which part? It is A point. It's normal, -3. But this B point or BA point is +5. So if we take reference as a hymen, then this is +5 centimeter. That's why it has been prolapsed. So the anterior wall has been prolapsed here, and the anterior wall, we have shown that it is a BA point which contains the bladder. So it is what? Can you see this? Can you thought that was a urethrocoeli? Here you can see is a cystocoeli. What is cystocoeli? The prolapse of bladder. Okay, everything other is normal. Let's go with the fourth example. As you can see here, AA point is normal at -3, BA point is normal at -3, C point is normal at -8. Okay, GH is normal -2, PB is normal -3, TVL is normal -10. The D point is also at normal position -10. BP is also at position of -10, but AP you can see here is at +2, which should be the normal point -3. So how the prolapse will look in this thing? Like this. This part has been prolapsed. It is +2, so the value will be +2, the +2 centimeter from the hymen. So this will be +2. So this is how the prolapse seen in this thing. Let's see this scenario again. This scenario. Can you see in this scenario what you can see? This is A is at -3 normal, BA is -3 normal, but C is at not -8. It is at 0 point. That means the cervix has reached at the hymen range. So it is a elongation cervix, or it can be a prolapse of uteroprolapse also can be there. That's why the C has reached to the 0 point. GH is -2 normal, PB -3 normal, TVS 10 is normal, D is -10 normal. But here D cannot be at -10. D can be at +10, or it can be at -2. So again, the cervix is always comes along with the other lip. So this is not the norm. It can be normal value of D. But again, I am telling you, you here need to concentrate on this thing, that is of C point. C point is a 0 point. That means the cervix is at the hymen. But the anterior and posterior wall are completely normal. There is no descent of either rectocoeli or not cystocoeli or urethrocoeli. There is only uterocervical prolapse. Let's see this last example here. Here you can see AA is a normal -3, BA is a normal -3, the CE is a +10. That means that the C point has been reaching the 10 centimeter below the hymen. You know, plus means below the hymen. minus means above the hymen. So C and D point you can see here, they are plus at 10. And how it looks like? It looks like complete procedentia, complete prolapse, third degree prolapse of the uterus. This is how things can be understood by the scoring of POPQ. I hope you understand this thing, but still if you have any doubt, you can comment on the box. I will definitely answer. Thank you.